In this first interview, we're talking with one of my favorite people, Dr. Cindy Trice. She runs Relief Rover, and she helps practices that need relief vets find veterinarians, and then veterinarians that want to do relief work, she helps them find practices that they can go work at. And with all the crazy stuff that's going on, we thought that this was a really important conversation to have because there, unfortunately, and as we'll talk in the conversation, the market has shifted a little bit. It used to be a seller's market in that the associate really controlled the conversation as far as the work that they wanted to get, how many hours they wanted to work, and now that has kind of shifted. And now with a lot of practices shutting their doors because of COVID-19, laying a lot of doctors off, there now are a lot more available doctors and associates than there are practices. So we really talk about if you're a relief vet, how can you still find work in this trying time? And if you're new to this space and you're now looking for work and you're a doctor and you're trying to find a practice to work at, what are some things you can do to shift that conversation and help move you forward? So again, I love Dr. Trice. She's one of my favorite people. Check her out at reliefrover.com. If you haven't, please help support this project at careforthehealer.com. This is a really great project and nonprofit. All the money that we make from all of our Patreon subscribers, it helps cover some of the underlying hosting costs of some of the tools that we have, but more importantly, the rest of that money, it's not going to pay me, it's not going to pay any of the doctors or any of the guests. We're doing this all for free because really we want to take that money to be able to pay a mental health professional so that at any point, emergency or not, if you're a veterinary professional and you need some mental health services in this crazy time, that you can get the help that you need. So again, please check us out at careforthehealer.com. Become a Patreon supporter for as little as $5 a month and really help a great cause. But again, let's get into this great interview with one of my favorite people, Dr. Cindy Trice.
Are finding the opportunities because that's going to help everyone in the end. Yeah. So good for you. Thank God for that punk rock background.
That's right. Yeah.
It prepared you for this.
Exactly. Yeah. Yeah. It is kind of interesting because I have just always had that mentality, and it's just, even with IT Guru, it's been like, well, what can we do? How can we pivot? Because if we don't pivot, then we're going to get left in the dust. And so how do you change? And I think that's a great segue into the conversation. Is it, as somebody who's working relief, how is this impacting relief vets, but how can relief vets pivot and how do they embrace the change, or how are you embracing it and what are you seeing?
So I feel like for relief vets, what I have heard from my community and just reading on Facebook groups and things like that, a lot of relief vets are losing their jobs, losing their scheduled gigs. And I feel like that can be divided into a few categories. So there are the relief vets that are losing their gigs who are sort of what I call true relief vets. So they're 1099 workers or independent contractors. They don't have any regular relief gigs. So it's not like they work Monday, Wednesday, Friday at this clinic and then Tuesday, Thursday at this other clinic, right? That's kind of what is termed regular relief. So there's the category of people who aren't that. They just work here, there, everywhere, and they build a business based on that. They're losing their jobs because I think many times because the practices are seeing less patients, and so they don't need the relief vet to come in, or the vacations that they were going to take, that the practice owner or the associate was going to take, they're not taking them anymore. So there's all sorts of reasons for that. So there's that category. Then there's the category of relief vet who are the regular relief vets. So these are the ones that technically, in the eyes of the IRS, are an employee because they're working regular relief at maybe 1, 2, possibly 3 hospitals. So they're sort of an employee, but they're losing their jobs because they're the first to be let go. Because the agreement between the hospital and the relief vet is that they're a relief vet and an independent contractor, even if they're being paid as an employee. So some of the questions that are coming from those people are, well, what category do I fit into? What rights do I have as someone who is paid as a W-2? Am I to be included in, as an employee if that practice applies for, payroll protection loan? So there's some, there's that category. Then there are the relief vets who are choosing to not do relief work because they feel their safety is compromised for whatever reason. Maybe they're a high risk person if they were to contract COVID. Maybe they live with high risk people. Maybe they have children out of school that they have to take care of. So they are being actually forced to cancel their scheduled shifts because of COVID. And so there's a lot of uncertainty about what's okay for them. So that's what I'm seeing out in the world. And then, and one of the big things that I would like to make sure happens, because there is going to be the other side of this, right? And practices are going to need relief vets. And we want to make sure that the relationships, the business relationships between the relief veterinarians and the practices stay healthy. Because I do think that there is some frustration on both parties. So if the relief vet is canceling their shifts on the practice, there's some frustration on the practice's part, even if they have a very good reason to do it, and vice versa. When the practices are canceling on the relief vets, there's a lot of frustration on the relief vet's part. There's a lot of talk about, should I enforce my cancellation policy or shouldn't I? But we want to keep these relationships productive and healthy, so it doesn't become an us versus them, and it doesn't become that mentality, because we are going to need each other. I don't think I exactly answered your question.
No, I think it was great. And you actually made a point that, practices are going to need relief vets on the other side of this. Before we started this, we were talking a little bit, and, you said for yourself that it still seems a little bit normal for you because you're still working. So are you personally primarily doing relief, or what are you doing in this time?
Yeah, so for me, in my area, I have had only one practice who needed to cancel a shift on me. Otherwise, all of my scheduled shifts have stayed in place. And I've actually been getting more requests because emergency clinics are very busy right now, because a lot of the practices either are shutting down completely. The general practices are shutting down completely. Those cases are getting diverted to emergency practices. And then plus the emergency clinics are open, so they're just seeing all their regular cases that we would normally see. I mean, animals are still getting sick. Animals need help, and that's why we are considered essential services. So since I do emergency, I'm getting a lot of emergency shifts. But there are also two practices that I'm working for now. One, because the associate lives with a family member who is undergoing cancer treatment and is very high risk. So she has chosen not to work. So then that practice, because they're still seeing patients for essential things, they still need help because it's a 2-doctor practice. That practice owner needs her day off. She has children who are out of school. So there's actually a need for relief vets even right now. So some jobs are going away and some jobs are being opened up. And then in another case, I'm working for a practice who the owner is older. So he considers himself high risk, so he's chosen not to practice. But he still wants to keep his practice open, so I'm working some shifts there to help with that.
You mentioned that there are some general, like GP practices, that are closing their doors, but yet then there are some practices. You did mention that ER right now seems to be thriving and kind of going. I've also talked with a number of practices that we manage, and it seems like the ones that really are embracing telemedicine and curbside really have only seen a drop off in the elective surgery department, right? Like dental, spay, neuters, that sort of thing. What are you seeing as far as GPs that are still open? Are you still working for any GPs? And what are you seeing for the ones that are really only losing maybe revenue on the elective surgery side, but everything else seems to be going strong?
I noticed a distinct difference. So I'm in Florida, and our governor was slow to shut down the state. And I noticed a distinct difference between when he decided to do statewide shelter in place after and before. So before, what I was seeing, even though the elective procedures were off the books, we were still really busy at general practices. We were seeing, now the curbside slows things down. It's a little bit harder to be efficient. And so I think probably overall the number of patients that get seen per day with curbside is less than if we weren't doing curbside. I don't know that for a fact, but it feels that way. But we were still really busy. Then the minute that shelter in place went into effect, it was a lot less busy. And I think some of that was on the pet owner's part. I think the pet parents if it wasn't super important, they were electing to stay at home and not come in, even if the veterinary practice would have let them in. The VMAs are, I think, well, I can speak for the Florida VMA. They have left it up to the veterinary practice to decide what is a needed service. You know, they haven't put into place any recommendations of don't do any wellness visits. You know, they said, we will let you as a veterinarian decide what is important for your patients, and you decide whether that is an essential service or whether that's something that can wait and be pushed off. So I have noticed that practices are interpreting that very differently. Some practices are no vaccine appointments, no wellness, anything, unless you're a puppy and you need to keep up on your vaccines. And some of them are still doing wellness to keep their revenue coming in. And I mean, if they have even one little tiny thing, complaint like check skin or check ear, then they count that as coming in. And some other practices are saying, nope, unless it's truly an emergency, you wait. So I think it's left up to the veterinarian.
So it really kind of determines based on the practice owner. And being a relief vet, you deal with so many different practice owners. Is there a certain personality type or something that you see come through in these practices that are like, now we're going to embrace this, you know, kind of like what we were talking about before, like, now I'm going to embrace what the state they're in and we're going to keep charging forward, versus the vet that's like, no, we're just going to kind of put everything on hold? Or the practice owner, I should say.
Yeah, from the practice owner, I don't know. I mean, I'm not sure how to answer that. I do think, and I feel so much sympathy for them. Like the practice owners are looking at their bottom line and getting worried. And so I understand that, you know, and they want to be able to keep paying their employees. They're worried for their employees, so they want revenue to keep coming in. And so maybe if that is the forefront of their concern, those are the ones that are more apt to try to keep things coming in no matter what. And then there's the other thought of, you know, this is a public health crisis and this is our responsibility to our community as a whole to limit exposure. And part of our responsibility as a veterinary practice is to not allow these people to come to the clinic, even if they're curbside, for, you know, things that don't need to be seen right now, things that can wait. So I don't know, I guess maybe there's a little bit of a mentality shift there. You had talked about telehealth, and I personally have yet to work at a veterinary practice that is actively using telehealth, which surprises me, but I haven't. But I do know that a lot are getting on board with that. And I think that this is one way that relief veterinarians can pivot and use our skills to offer teletriage, right, or tele-advice, because we won't end up having a VCPR. And some of these telehealth companies are hiring relief vets on to do that. So that's another way that we can use our skills. And I've thought, and I haven't had this personal experience yet, but some of the practices that are hiring these companies to put telehealth in place in their practice with their clients. And if I'm a relief veterinarian there anyway, like I could answer their telehealth calls or help field those questions and do those kind of things for their clients, which is exactly what we do when we're at the clinic as relief vets. So if I'm physically at the clinic and I get a call from a pet owner and I haven't seen that animal myself, I am still able to refill meds and dispense things because they have a VCPR with the clinic and I'm acting on behalf of the clinic. And to be honest, I don't know what the rules are around telehealth and that type of relationship. I would imagine it's the same because we do that over the literal telephone. So I don't know why it would be any different if we were doing that on behalf of a practice that we have a relationship with over this kind of phone or a computer. I don't know why it would be different.
Yeah, it's a great point. I think, before all this hit, last year, talking to practices about embracing the telehealth side of things. Again, you're 100% right. A lot of them don't realize that they are already doing it just via a physical phone, right? They're doing it just via phone, instead of a Zoom call or BabbleBark or Teletails or whatever you want to use. With the practices that I have talked to, we have looked at a number of different ways that they can embrace the social distancing and the curbside model or the telehealth model. So we have some practices that are just doing a DIY model where they're using Skype conferences or or like a Zoom call, like we're using this on this meeting here. And then they're basically just sending them a digital invoice via Vimeo or PayPal, and they're getting that exam fee up front. The exam fee, I think, is also an interesting question in this whole thing. Most practices that I've talked to are charging a premium and not getting any pushback. And it seems that most of the pushback has come from the associates. So the internal docs that are like, no, they're afraid that their customers aren't going to like it. But all the practices that have had some sort of telehealth in place, when I've asked, well, have you gotten any pushback from your customer base? So far, I haven't heard one tell me that yes, they have. I'm assuming one will come in at some point, but it just seems the greater consensus is that the market is used to this kind of model, which I have a friend works in ER, human health doctor, and he actually works from home, I think 2 or 3 days a week, just managing telehealth calls before all this. So I think we're very used to this model. And I know veterinary medicine hates to say, we hate as an industry to be like, okay, well, what's human medicine doing? Let's adopt it. We're not the little brother of human medicine. We are our own industry. But I think this is one of the examples where it just shows us that the market is open to it and maybe we should really embrace it. And hopefully this is the segue that pushes us to do it.
Yeah. And and I do think relief vets are very well situated to help and could help these practices have revenue keep coming into their clinic and without taking away from their associates. And we can drive pet owners to their practices as well. So I think that it can be a great relationship. So a great pivot for relief vets, but also something that's good for the practice and for the associates.
One thing you had me thinking about is we have one practice that I think the other day they received over 250 phone calls on average. It's about how many phone calls are coming in. And so it made me think of like the Whisker Doc services. So, why not leverage your relief vet to, you could easily set them up with the phone transferring to them, depending on what your infrastructure is set up like, but get them a phone and have them handling a lot of these calls. And again, just doing kind of some of this over the phone consult, you could probably charge for it. I mean, there's a whole sorts of things there that could be done, and the relief vet could do that from their homes. You're embracing the social distancing and all those sorts of aspects. So before all this hit, have you ever seen any relief vets being leveraged in that way, managing remote cases?
No, but I think I haven't. That doesn't mean it's not happening. I just haven't personally seen it. But I think it's such a great way to utilize relief vets. And it can fall into both of those categories, where it's the relief vet direct with a pet owner who maybe doesn't have an affiliation with the clinic or a clinic, or a relief vet that that isn't affiliated with their specific practice. But also, if you're a relief vet that is affiliated with a practice, and especially if you're one of those relief vets that works at that practice all the time, the clients know you. And so they don't even think of you as a relief vet, because they may see you enough to actually really categorize you as a team member of that practice, which you are. That is something that I have not seen utilized and leveraged near to the way that it could be. Because a lot of times if I think back to when I was an associate, I was utterly overwhelmed with the amount of phone calls that I needed to make after my shift. And every veterinarian can relate to this, especially if you work at really busy practices. I worked at a really busy multi-doctor practice all day long. Dr. Trice, Dr. Trice, Dr. Trice, Dr. Trice, all day long. And, it's nonstop. And so at the end of the day, I would be troubleshooting and treating patients and talking to clients and doing this all day long. But meanwhile, there's a huge pile of people who are calling in to ask me questions. So then when finally the doors closed and we're not letting in any more work-ins or appointments or drop-offs, finally the doors closed, I not only have a pile of records that I need to deal with, I have a pile of callbacks. And many of those callbacks are questions that could be answered by lots of different types of people. Some of them are appropriate for, veterinary technician to answer, or even, a customer service representative. But sometimes it does need to be a veterinarian, but it doesn't necessarily have to be me. And I think if you were able to leverage a relief vet that you had a relationship with, and you could get those questions answered much more quickly, and potentially even drive that pet owner to the clinic for services if that was the need much quicker. You make the pet owner much happier because you get their questions answered quicker. I mean, I was calling people. I did a cutoff of 9:00, but up until 9:00 at night, I would call people. And for the most part, people appreciated it, but sometimes they were like, "Lady, it's 8:45. Why are you calling me?" And I'm like, "Because I wanted to make sure you got your question answered today. I didn't want you to have to wait." And wouldn't it be great if there was some sort of system in place where relief vets could, during business hours, answer those questions much more quickly, troubleshoot them, and make sure the right thing happened?
For a practice, I mean, depending upon the infrastructure and the security you have in place, I mean, it would be pretty easy to get a relief vet access to the practice management system remotely in a secure fashion. The question that it made me think of is and you kind of answered it as I was writing it down, was there is an opportunity for relief vets to seize this call volume and seize this callback. Is there a way that somebody who's done a lot of relief and maybe is losing some jobs because X clinic is not going as well or whatever, that maybe they could make that pivot and say, well, let me handle your doctor's callbacks, or let me, would that even be an option for a lot of these practices, do you think?
Yeah, and I think the idea just needs to be introduced to them. But you're right. I mean, that would be a great discussion for a relief veterinarian to have with their practices and see, And especially for the ones who now are adopting telehealth platforms. And I know that these telehealth companies are working really hard right now because they're getting so much interest and volume of people who want to sign on now, especially for those companies that are building that. But even like you said, there's the whole do it yourself type with Zoom or Skype or Google Hangouts or whatever it may be. So I do think that relief vets could present that to their clinics as a way to continue to earn revenue and maintain the relationship, and maintain their connection to pet owners and to continue to be able to help safely.
One thing that I also thought of that one of our clinics in Orange County was doing is that how they were doing some sort of like a triage service, but I just thought that this would also be another good opportunity for relief vet is when the patient arrived or the customer arrived, they would park, they were guided into the building. So the receptionist was still at the desk. And then there's kind of like, they had arrows on the floor to a certain reception room. They walk to this reception room. So they come in, the receptionist is from a distance, hello, and then the receptionist is probably also cleaning the door handles and all the stuff that we have to do right now, post them coming in. Once they came in, they went to this one dedicated exam room where they had essentially a laptop set up with, it was really locked down, nothing on it. So it's kind of like a Chromebook essentially with a burner Skype account. And as soon as they got in the room, the doctor that was back in the technician area would then call that Skype call, and they would start to have an interaction in the room, and they would start to talk, and they would go through the exam process, and then the doctor or tech would come in and retrieve the animal, trying to be as safe as possible, and then take them back to the tech area. All the while, this interaction is still happening via like a Zoom, like a Skype call in the clinic, just with some burner accounts, so there's no security issues. But that had me thinking, there's a lot of doctors that probably don't want to work right now. There's cases that are probably pretty easy. Again, how easy would it be for a relief vet to just kind of be set up in that tech area and handling even these kind of calls where they can still see the animal, they still get this face-to-face interaction kind of closely, but, mitigated, almost like a prison cell type setup. So as I was thinking through that process and how all these clinics are adapting, one thing that came to mind and I love is, how are relief vets, and you could really speak to this, is how are relief vets getting work in general? And then how should they look at getting work now and understand how, and maybe even the idea of kind of marketing some of these ideas, like, hey, we could set up this DIY telemedicine service, or we could leverage telehealth, or I could be your personal whisker docs, those sorts of things.
Yes, I think that like a lot of people, there's two ways to look at this whole situation. We can be super distressed about it, which I don't discount that. It is distressing, but we can also look at it as an opportunity. And I think one of the great things about relief vets, and I think why in some ways we're sort of well suited to this kind of situation, we're used to having to be flexible. I always call it a relief vet, we have these superpowers, and flexibility is one of them. And this moment requires flexibility. And so I think being flexible about the services you offer. If you've been only doing GP, consider doing some ER. I know can be scary for some people, but you've got the skills, you've got the background. Branch out, find other types of practices that need your services, and be willing to use that flexible mind that you have and go out and do that. Offer to take calls, telehealth calls for your practices. I think that's such a great idea, for them to be able to send out maybe letters to all their practices and say, hey, this is a service that I can offer for you. I will help you maintain your relationships with your clients. You and I have a relationship. Let's keep that going. And this is what I can offer. And that will keep your revenue up and my revenue up. So I think flexibility of the types of practices you'll see, telehealth. I think there are some other things that are coming out too. Like people are looking for I call it voice of customer. You know, those when the questionnaires that you get that people will pay for, sort of consulting or voice of customer more than consulting. But those are ways, like looking for opportunities to earn a little bit of money that way, improve your value, because I've always said relief vets have so much more value. They have so much value that goes beyond just the clinical services that they offer. By virtue of the fact that relief vets go from practice to practice to practice, we're really well suited to learn about a lot of different technologies, about a lot of different therapies, a lot of different diagnostics. And that information has value. It has value to companies. And so leveraging some of that, finding, and that's one of the things that Relief Rover is doing right now. We're looking for ways to leverage the value that relief vets have for their benefit.
So I think that's really where that's where we need to take this conversation. I think that is kind of the idea, especially with so many vets that have potentially been laid off. You know, what sort of, if I'm an associate and I'm now looking for work or I'm out of work, how can I leverage relief and how can I move into maybe a relief model temporarily until I can find another job? What are some of the ideas around, again, this idea of improving your value and pushing that value? But first, before we get there, everybody who's watching this, if you want to watch the end of this video, you have to go to careforthehealer.com and support an amazing cause to help vets out there, all veterinary professionals really, CSRs, vet techs, associates, practice owners. What we really want to do is we want to help everybody get the mental health services that they need in this time. And again, it's not crisis only. If you're just having a bad day and you need somebody to talk to, you can go to careforthehealer.com and get that help for free. But of course, we need amazing people to support it. So please go to our careforthehealer.com, support the Patreon page, and help create a great cause.